Good evening. Welcome to I'm Listening, Stay Connected. I'm Listening is a 24/7, 365 initiative that works to normalize talking about mental health. That's the goal of our show, is we want us to acknowledge the importance of mental health, talk about our own, but also get those around us to talk about theirs. Tonight we've got a great show planned for you. We have Barrett Foa and James Q Simmons. We'll be talking about acting, the industry, dealing with COVID-19, self-isolation. But right now, let's talk about bizarre dreams. Yes, they are on the rise. A lot of people in both my practice and also in the media and out in the world are talking about the fact that for the first time, they're possibly having or remembering their dreams, and they're quite vivid and they are quite intense. So what is that about? Well, we are moving through our days with a lot more stress and tension. And even bigger than that is we are left sitting with ourselves. So that allows for a lot to emerge. But remember that a lot of our non-waking life has value and importance, and that comes from what we are bathing our brains in during the time that we're awake. So we're definitely watching more news and hearing more conversations and social media posts that have a lot of darker undertones woven in on it. It is people passing away, it is job loss, it is struggle, and our brains are internalizing all of that. So it's very understandable that at nighttime, when our brains are doing what they're supposed to do, which is consolidate memory, which basically means strengthen the important parts, let go of the lesser important parts, that stuff is going to get processed through our brains. So what are the ways that we cope with that? Well, the first thing I'm reminding everyone is, we have to accept everything right now as the new normal. Everything and anything that's happening, we have to allow a level of acceptance, just kind of let it happen. But second to that is also know that a lot of stress and tension is going to be read by anxiety. And that's going to show up in our brains. So move to expel some of that energy. Also keeping a routine, keeping ourselves active and busy will help with that. And then finally, making sure you are not constantly bathing and surrounding yourself in darker undertone movies, news, conversations, social media posts. It sounds kind of corny, but winding down your day with some positivity and framing it that way in the morning and at night is what's going to help us kind of live in that, start our day with that, and also wind down our day. So really be thoughtful about that. Remember, whatever is on the outside in your life is going to start to become internalized. So right now we have to have a little more thought about that and some control over that, because we don't want to be winding down our day with those darker things going on. So it's basically it's about good sleep hygiene, going to bed at the same time, positive things, and just kind of setting some time aside to transition into sleep time. A lot of us just kind of flop down into bed and then don't think a lot about that transition. But right now, let's go to Barrett Foa, actor, NCI Los Angeles. How's it going? Thanks for joining the show.
I'm so great. I should probably put these on.
Yeah, right? Yeah, it's a headphone thing.
It's a headphone thing. Hi.
How are you?
Can you hear me?
I can.
Good. I can't hear you.
Oh, that's not good.
This is, we tested it and everything, and suddenly it's not working.
Can you hear me without the headphones?
I'm going to do this. Sorry.
That's okay. How's that?
Is that still okay?
Yeah, it's great.
Okay, great. It's so funny you were talking about dreams, because I've been really good. I only get my news off of the New York Times app, which feels like I'm always reading it in my head, reading the news story in my head, and it's in my own voice. Week or two ago, Instagram, brings me to another video right before bed. And of course, it's some people congregating in a church and saying that they're not going to get COVID or give it to anyone because they're bathed in Jesus's blood. And for some reason that just got me really angry. And that night, of course, I have a dream that a tiger or some lion, probably a tiger, because I was watching Tiger King at the time, comes in or just leaps out of the darkness and tries to maul me and attack me in this way. I never have dreams like that. I just never have dreams like that. And suddenly that I woke up in a panic, and that spun me out for, I would say, 3 days. Like, I was depressed because of this dream and just because of this kind of one video right before bed. So what you were saying about what we're ingesting is very important. I'm going to keep it to the app.
Yes. So much to unpack in what you just said, Barrett. And like a good Rorschach, I just learned a lot about you. But
Did you learn about me? You're going to analyze me now?
I sure did. Your mental health's good there. Mental health's good. You're right where we're supposed to be right now.
What's that?
You're right where you're supposed to be with the mental health. A lot of new creative things for us. But start with that piece. When I ask you in general, how is your mental health? How do you feel like you're doing right now?
I'm like up and down and over the river and through the woods, and who knows? But on the whole, thank God for my meditation practice, which I've had for 8 years and do 20 minutes twice a day, and that I can be with myself. I can let things go and come. I've practiced that. Yeah.
No, I was going to say, what a gift. Things like this are some of the things I preventatively tried to build into my patients' lives, not knowing something like this was ever going to come. What a gift that you had that accessible already.
Can I say that it is every day that thing is a gift. I'm so grateful for it. And I just had therapy, a Skype session, earlier today, and he was saying that the people who have already had therapy and the people who are going into this with therapy and the people who are going into this with a meditation practice, they are having an easier time than those who are kind of just starting these things or haven't really heard of them. So I'm lucky to have come into those things, both of them. I also have my dog, who is a living, breathing being, which is sometimes more than other people have. Would love to have someone else in this house with me, but that's not happening right now. So dogs, we're grateful for what we have. So I want to say more about that in a second, but I don't want to keep talking.
Well, I saw the photo of you with your dog on your Twitter. Adorable. I was going to ask you about that because for those of us that are self-isolating, literally alone, pets are like a welcome second energy and life in the room. Oh, here he comes. Here he comes.
This little guy.
What's his name?
I just said Guy. I don't know why. Her name is Scotch. Which was my grandmother's favorite drink. She drank it every single day. It's also my favorite drink. And I've had her for about 8 years. I rescued her when she was 6 months, and it's really great to have her, I have to say. If you're ever thinking of fostering or adopting, now is a great time. I know a lot of people are doing that now. That's a great source of mental health, and people have time to deal with it, and I recommend. What else? Oh, so this morning I was going to say, someone sent me a podcast, the Daily podcast. They had a bonus episode called I Forgive You, New York. And I highly recommend listening to this little 10-minute poem. It's basically, the author is just saying how much he forgives New York for the pigeons and the rats and the homeless people pissing on the streets and the drunk people puking and the noise and all of it. It's like a 10-minute long poem of all the horrible things about New York that just make you love New York. And I'm just born and raised in New York, and I've lived there forever. But I think the grander thing is what he's talking about is gratitude of just, once those things are taken away from us, all we want is them back, even if it is things that are, not so beautiful.
Yeah. Gratitude. We need it so badly right now. I mean, yes, watching rats eat an entire piece of pizza in front of you, you can't get that in LA.
You're like, I need that back. I didn't realize how I missed that, Also, now I'm just going to keep talking. Is that
Please.
Okay?
It's great.
I'm going to make her talk with you. Another mental health thing are these, I'm going to try to point at it. I can't do it. These flowers. I went to a lilac farm. I saw on someone's Instagram. It was about 40 minutes outside of LA. I was like, I can jump in my car. I basically have not been in my car since this whole thing happened. And I went to a lilac farm and bought some lilacs. It was gorgeous. And then I went to see the poppies of California that I'd never seen before. Have you ever seen those?
No, I haven't had the time, but it's on the list. It's
like a 40-minute drive. Go out. It's the most gorgeous thing ever. You're just reconnected to nature. You're outside. You don't have to be wearing masks. There are other people there being Instagram people and taking their photos, but who cares? Scotch and I went. We frolicked in the poppies. We felt like Dorothy and the Wizard of Oz. It was so gorgeous. It's absolutely stunning. It's these yellowish orange flowers for as far as the eye can see. It really gives you some perspectives.
Just to circle back, the tips you're dropping, I think, are phenomenal. Therapy, meditation, get a pet, go outside in nature. I mean, you're hitting like the big four.
Gratitude. Yeah.
Gratitude. Yep.
Exercise is next.
Oh,
do you want me to just for you?
Can you show us as well? You have a large space behind you. Yes, please.
I'm not going to exercise for you. But I did do yoga with a friend I barely know who's in New York. And we pressed play on a yoga app at the same time, and we felt connected. We made our own class.
Barely knew. Was that a date, Barrett?
Maybe.
We're going to set you up.
So let's do it.
All right.
Out there.
I wanted to ask you some questions about your career as well, but thank you for sharing all that. That was very vulnerable. That was very beautiful. It was actually very, very helpful. You're weaving in those tips. Your career, you kind of hit the powerful gay trifecta. You did Avenue Q, you did Will and Grace and Angels in America. That's pretty astounding.
Yeah. Oh gosh.
Yes.
I never grouped those together, but
Iconic.
I will absolutely take all three of those.
For your Wikipedia, I just wrote that part now.
Please do, because no one's written my Wikipedia pages. Basically, it says when you go on it, it says, "This is a terrible page. Someone please redo this." Can you do it?
After I get my own done. That hasn't happened yet.
Perfect. No, I never thought of that. It's funny. I was actually just listening to Avenue Q. No, I wasn't listening to Avenue Q. I was asked to do a song for a benefit for the theater that I did, Angels in America at, which is at the Repertory Theater of St. Louis, an amazing theater. And they asked if I could, lend my talent and sing a song for some gala that they were doing online. And I was like, what am I going to sing? And I thought of the finale number of Avenue Q, which is called For Now, which basically just says, life is fleeting. Everything in life is only for now. If it's bad now, it's going to change. If it's good now, it's going to change. You got to let it flow. You just got to keep going with it. You got to make compromises. And I found this way into the song that applied to what we're going through now in such a beautiful, simple way. And I highly recommend a listen to For Now from Avenue Q. It's gorgeous.
That's number 6 on the self-care list. I'm all about it. I'm tracking it for you, Barrett. Don't worry, I got your back. I landed that point for you. You were like, I don't know where that was going, and I was like, I got your back, buddy. So we also wanted to ask. We have to ask, of course, about NCIS Los Angeles. You tweeted out saying that it's going to be the last new episode for a while.
Yes.
What does that mean? Is that pandemic related? What are we to expect? When is it coming back? What the heck's going on?
Oh, that's what the studio told us to say.
Got it.
I have to say, no, I think they're just reluctant to call it the season finale because the thing that the show that aired was not actually supposed to be our finale episode. We had written it. We were just about to shoot it when they stopped production. So, yes. So instead, we moved this to the finale, and it is a very exciting episode, and it's going to be the first new one for a while. But like anything, we don't really know what's going on. So we'll be back at some point to film that wonderful season finale, and just don't know when that is.
All right.
One thing is that and part of the reason I'm growing out my hair and this porn stash is that there's another show that I can't say the name of that I am planning to be on for like 6 episodes, which will happen soon. But again, that was about to start in early April and kind of went away. So everything's on pause, but it's also why I have a lot of hair right now that I'm just trying to pretend it's not a huge fro.
You're wearing it well, Barrett. Hang in there. You're wearing it well. It's worth it. Barrett, we had some questions that came in that I would love for you to answer with us.
Great.
This one asks, as a theater geek, I'm curious how you think this will change Broadway. When shows are back, do you think people will flock or hold off?
God, I have to take a big deep breath for Broadway. So I was trained in musical theater, and as soon as I graduated college, I moved back home to New York City and was on Broadway for 10 years. I always thought New York was going to be my home, and that theater was going to be my life. And then NCISLA came along and my life changed. But I will always have my heart with Broadway and the theater. So a lot of my friends I don't know what they're going to do right now. And that is my heart, and those are my friends, and that's my old community and still my community, I feel. And are people going, I'm a little nervous for that. I'm nervous for restaurants and for theater, which are my two loves. I love food and I love theater. I'm scared of Broadway. I don't know if people are going to feel comfortable sitting right next to someone else until there is a vaccine.
Yeah.
Someone said something about, fall of 2021 or something like that. I mean, my heart sank. So I'm reaching out to charities like the Actors Fund or Broadway Cares Equity Fights AIDS, which does more than just AIDS relief. And I'm just, telling my friends that I'm there to support them. But I don't know what we're going to do. But I do know that we're going online. I do know that there's a lot of concerts online. There was a Sondheim 90th birthday concert last night. And we're going to try to keep the art form alive because people want to be entertained. They need to be entertained. And we're here to do that. And same with television production. We're going to get up and running and figure it out as soon as possible. Because there's entire industries and entire careers that are kind of on hold right now.
Yeah. Well said. Well said. We have another question. This one requires your thinking cap a little bit. This one asks, and these came in directly to you. This one asks, how would you help someone with something you never went through? I'm not sure how to support a friend when she says that I don't understand how it feels and she's right. So how do we support friends who are struggling with things that maybe we personally haven't gone through?
I think just telling them that they're there to listen, that you're there to listen, help in any way you can. I can't exactly relate to what you're going through, but I'm a sounding board and I can give you advice if that's something that you need. Is that?
That's good. I mean, care and compassion. I'm here, right?
Compassion. Yeah. And not trying to, here's my thing. I'm actually talking to myself here. I'm trying not to be like, I'm here to fix the problem. Because that's my go-to, right? I always say that I was kind of raised by two guys. Like my mom was very solution oriented, as was my dad. So I didn't really have a lot of that like emotional compassion. Oh, it's okay kind of thing. So I want to solve everyone's problems. So can you tell I've gone to therapy? So I'm unpacking it all for you. So what I'm saying is you can say that you're there to give advice, but maybe don't always lead with that. Ask if that's wanted.
That's right. Just give them the presents. Barrett Fowa, thank you for being part of the show. Good luck with your date. If it doesn't go well, we'll have you on Loveline. We'll set you up.
I'd love it. I would love to.
All right. Nice to meet you. Have a beautiful night.
Meet you.
Bye-bye.
Bye.
There it was. That was a stunning list of self-care tips. And these are the things that we want everyone to be practicing. Listen, it's never too late for anything. Now is a great time to start practicing some of the things that preventatively could have helped us, but meditation is something great to get into. I love the idea of people getting out into nature in any way possible while still honoring social distancing. Please wear your masks. Also, adopting a pet. We are home all day long. The pets need homes. You have the time. You want the energy. You want something to take care of. hugs you back. I can't tell you how much having a pet has helped me get through this myself, especially for those that are self-isolating on their own. So definitely take advantage of all of that. So many resources available. And also, if you have the funds to give, definitely try to support some of those charities. There's a lot of industries that are massively hurting performers and the people behind the scenes as well. So definitely consider doing that. That was well said. If you want to join the conversation, you can always do so by sending your questions into our Loveline IG DMs or by tweeting your question at #I'mListening. This question that came in asks, is this ever going to end? I'm starting to lose it, and it feels like there's no end in sight, and people keep breaking the at-home rules, so I don't doubt that that will make this last even longer. It's definitely going to end. That's 100% for sure. When it's going to end is determined by us following the rules, and unfortunately, that is also determined by the local legislators. The mayors and the governors themselves are making different decisions. We have the Center for Disease Control with their own recommendations, and then, of course, the president giving his own recommendations, so it really depends on the cities you're living in, and we'll be talking about that later in the show, but there are some cities that have slowly started opening up. So, again, be very thoughtful. Just because an area has opened up and relaxed their stay-at-home orders doesn't necessarily mean it's the safest thing to do. But if you're going to leave the home, still maintain some distance, wear those masks and things like that. Now let's go to James Q Simmons, nurse practitioner and founder of Ask the NP and family member of the show. How are you, James?
Hello, I'm doing very well, Dr. Chris. How are you?
I'm doing well. So my first question is, for those of us that have been tracking the news, what the heck is going on right now?
Oh, man.
we have a little bit of a credibility problem going on.
It's something else, isn't it? I actually, I just did a video for kind of the people who follow my feed and other places about how I think we're in this really interesting time and place right now where I think it's really important for everyone to just kind of slow down and breathe. The number of conspiracy theory videos that people have sent me just in the last 4 or 5 days has just skyrocketed because there are so many other individuals out there who are saying it's all been a lie, it's all a hoax. The media has been lying to you, death rates are wrong, all of these different things. There's a reason all those people were out on the beaches in California and other places. And I think we've gotten to that point now where everyone is so itchy to get out. Everyone's so anxious to get back to normal. And we are, this, Dr. Chris, our brains try to fill in the gaps when we can't make logical connections. Our brain fill those in. And sometimes those manifest as dreams, and sometimes those manifest as memories that are not necessarily true. A lot of our memories are false because we fill in the gaps of things we can't remember. And I think we're doing the same thing now. I think everyone is just like, oh, I got to fill in the gap for this. And this thing that's not happening to me, it's happening in New York or it's happening in New Orleans, but I live in Kansas. Why do I not have a job? Why can't I not pay my rent? Oh, they've been lying to me this whole time. Okay, that makes sense. And then they run with it. And what it's starting to do is make this whole fear culture that we're in right now, it's starting to really amp that up. And it's frankly pretty scary.
Yeah, and I was looking at the stats just today out of LA County, and it kind of took the wind out of me listening to everything you just said and looking at some of the towns and cities that have been opening up slowly. So Mayor Garcetti, our mayor here in Los Angeles County, said that COVID-19 is now the county's leading cause of death. And we had 29 deaths today, 942 total. It's a big number.
It is a big number. What I will say about LA County, which is really great, is that we have sort of this peak that we were talking about having in LA County never really peaked, which is great. We flattened the curve officially, but what that means is it's going to draw this out. And so while we're still getting numbers of individuals who are dying from COVID-19, and it's still a number, I think one is uncomfortable, right? But the numbers of people who are dying on a daily basis are uncomfortable. It's getting better. It's not skyrocketing up, which is why even in places like New York, you see Governor Cuomo is talking about, okay, we got to start having these conversations about what are going to be our plans to reopen and how is that going to look. And I think the experiment here in California, or at least in certain counties in California this weekend, was, well, let's open the beaches because it's very hot and maybe people can maintain some sort of social distancing on the beaches. And as you can tell, and I don't know if the viewers and listeners saw, people did not maintain social distancing on the beaches this weekend.
Yeah, they definitely did. And I was also looking at the photos from Atlanta, and, the gay community was out tight and strong at the gay bars. Yes. I saw photos of people's house parties, no masks, everyone bumping into each other. So connect that to something you said a minute ago. We want to celebrate that we didn't have to hit the peak and that we're flattening, but we don't want to take that celebration, I guess, out into the streets or into the beach yet.
We're just not there yet. We really aren't. And as difficult as it may be to hear that and to really sort of accept that, I get it. I'm just as anxious. The only times I leave my house are to go to the hospital to work. Or to the grocery store like everybody. And I'm getting just as anxious as everyone else. But I think this is one of those situations where if we can almost rationalize, if you will, if we buckle down and hang on for a few more weeks and do this the right way and give our elected officials and everyone else, the public health officials, a chance to really ramp up testing, which is going to be so key, then we can sort of go back to our normal lives. But until we have an opportunity where we can test almost everyone, and then the only people who are getting isolated are the sick, and then everyone else gets to go live their lives, or we get an antibody test and we can confirm that the presence of antibodies is protective, because I'm not sure if you saw the WHO announcement last week, but the WHO was saying simply having the presence of antibodies in COVID-19 so far is not necessarily proving protective against reinfection. It's too early for us to know. So we really have to get to a place where we can ramp up testing, test everyone, those who are infected, asymptomatic or not, it doesn't matter. Those who are infected have to quarantine for 2 weeks at least until they run the course of their disease. Everyone else gets to go out. That's, as far as I can tell in my professional experience, that's the model that's going to have to happen before we should be back out in the gay bars, as much as I miss them.
And that's why, like in my field, we're using the word healthy anxiety or protective anxiety. We don't want people to be panicking, but you have to have just enough anxiety that this is a real thing and things are still possible to kind of keep yourself at home. Because that's a question I keep getting asked is like, when is this going to end? And San Francisco, certain counties up there have just extended the stay at home through May. I mean, so they're hitting like the June 1 already. So I guess it's going to depend. So let's talk about something else that just made headlines. This is coming out of the UK, the first patients injected with the vaccine. And they said, and this was interesting, they're 80% sure it's going to work. What are your thoughts on that?
So what a lot of people don't know about vaccines is that we usually parallel path this, meaning there are lots of individuals who work on vaccines at one time because most vaccines don't work. So you got to have a bunch of people working on vaccines at one time until you make the right tweaks and adjustments to get it to a place where then, we found a vaccine that works. And there's a certain threshold that kind of public health officials, epidemiologists, infectious disease experts have for a vaccine to work. So it has to be protective a certain percentage of the time. And that's when we deem, all right, this vaccine gets the stamp of approval. So there are several organizations working on vaccines right now. Oxford University in the UK seems to be the leader, if you will. It's not necessarily a competition, but they seem to be the ones that are leading because they were already working on a vaccine in development for a similar SARS coronavirus. And they had already were at a step where they were moving to human trials. So they had moved it away from primate trials and they were moving it toward human trials. Well, they were already so far ahead of other organizations that they could just kind of make tweaks to their vaccine and then start to give it. So there, some reports, the New York Times actually reported that Oxford University vaccine, the one that's kind of leading the pack right now, could be available on mass quantities as early as September.
That's what I read as well. Yeah,
I feel like that's really aggressive, just knowing how vaccines work. But I also know that we're in unprecedented times. And so nothing's typical. The course of the disease is not typical. Us having to be quarantined is not typical. Our lack of testing early on, our lack of response early on is not typical. So it's reasonable to ascertain that Oxford University and other organizations might actually pour all of their resources into this one vaccine if that one shows the best propensity to make it, if you will.
All right. We have some questions that came in that I'd love for you to answer with us. This first one, I get asked frequently, but I think it's really important for you to weigh in on it to help people kind of decrease their anxiety around this. This question came in and asked, how safe is it visiting a medical clinic, urgent care, or hospital for non-COVID health issues right now? And I'm seeing a lot of people talk about that. For whatever reason, they might need to go get some kind of medical care. They're possibly staying home. How safe is that?
Mm-hmm. So on the whole, it's very safe. But I think the sort of the bigger issue here, and this is something that I actually talked about today as well, that if you feel like you're maybe having a heart attack, so you're having the chest pain, or you might be having a stroke, the acronym we like to remember with stroke is FAST, face, arms, speech, and then T is for time. So if you have your face is drooping, your speech is slurred, you have one, like your arm, like one side of you that is numb, or you can't move it at all, there's a high likelihood that you're possibly having a stroke. You should call 911 and go to the hospital. For emergent situations, and in general, if you need healthcare, let me talk about strokes and heart attacks first, I guess, in one. The likelihood that you're going to have long-lasting effects from a heart attack or a stroke is much higher than you having long-term impacts from COVID-19 or unfortunately even dying from it. You have more of a chance of dying from a heart attack or stroke than you do COVID-19. So if you just know that as sort of a bottom line and say, all right, I've been having this chest pain. It's worse when I walk around the house. I have nausea, vomiting. I have, risk factors for heart disease. I think I'm having a heart attack. You should absolutely call 911, please, without hesitation. Things that can maybe wait, your primary care provider, your physician, nurse practitioner, whoever, they have time. Email them. Call their offices and say, hey, I think this thing is going on. I'd like to see you. Is it safe? And that's a discussion you can have with them.
And I like that you provide that. Call them. They'll instruct you. They'll let you know levels of safety if they can assess you over the phone. This is an interesting question that came in, and we might have to discuss this more as we kind of move forward and businesses open and stores. This one asks, we have our temperature taken at the door at my job, but how is temperature effective in screening? If someone takes a fever reducer before work, could they cheat the system? That's interesting.
Ooh,
yeah,
that is really interesting. They take our temperatures as well when I go to the hospital. So you're right. You could absolutely cheat the system with that. If you take either ibuprofen or Tylenol, which is acetaminophen, those two medications work great at reducing fevers in most people. So you're absolutely right. Someone could cheat the system to be working. I think what it speaks to sort of is the larger conversation about how do we figure out who is asymptomatic, who are carriers, who are people who've had very mild symptoms and didn't realize it was COVID-19. Their symptoms were so mild, they didn't feel the need to get testing. And then those individuals are potentially spreading this in the community. The CDC actually just announced last week as well that they're adding new symptoms to the list that could be COVID-19. So all of a sudden, not only is it fever, which is something we check for, but there's sore throat, what we call neuralgias, like numbness and tingling out in the body, or myalgias, like muscle pains. So there's these other symptoms that are going on that we didn't think were COVID-19 before. So I anticipate that there's going to be a whole symptom screening check that will probably happen, even more than just taking your temperature. So likely if someone took ibuprofen and they brought their fever down, well, if they're being honest and they have a sore throat or something like that, we still might be able to catch it.
Yeah, and the tagline is, Dear God in heaven, what you choose to do right now impacts so many other people around you. Please be honest.
So many people. So many people. Yeah.
James Q Simmons, thank you so much. We'll see you soon, I'm sure.
My pleasure. Absolutely. Thanks, Dr. Chris. You too.
Bye-bye. Yeah, and just to follow up on that one point, I a couple weeks ago, 2 weeks ago, had to go see my primary about a health concern, and I felt very safe. People are definitely taking a lot of precautions, especially in the healthcare field. So please let some of your anxiety drop. But I like what we just talked about. Call. Reach out, let them direct you and let you know how to handle and make your next step. They're there for you. They're there to help you. All right, 24/7, 365. I'm Listening is an initiative to help destigmatize mental health. If you want to join the conversation for any of our shows, you can do so by sending your questions into our Loveline IG DMs or by tweeting your question at hashtag I'm Listening. I have a final question that came in, and this one asks, wasn't taking this seriously until I lost a buddy from COVID and it hit hard. I'm afraid to do anything now. I can't can't even go to the store. I'm living in a state of fear for everyone in my life, and I don't know how to snap out of it. This is basically possibly shock for you. You weren't taking it seriously. It wasn't something that necessarily you had encountered yet. A lot of us have slowly been encountering this and dealing with different forms of grief and loss and anxiety. It all possibly hits you at one time. So go easy on yourself. Take a break. Sit still. Have this conversation with those around you, share your thoughts and feelings. I mean, that's the whole purpose of the show. We want people to connect with themselves, talk about everything they're feeling. So express what you're going through, give it time, let all the ways you feel and the ways you cope with that feel normal to you, but go through your process. For those that didn't think it was something that they're going to have to encounter, it can be very, very overwhelming. So care and compassion for yourself. We will be back tomorrow, 5 p.m. Pacific, 8 p.m. Eastern. Send your questions in and follow those steps. It's all about self-care. Get a dog, some meditation, a bath. Self-care is what's going to get us through all this as best as we can. We're here for you. Thanks for hanging out with me. And you all have a beautiful, beautiful night.